Okay, this is our chapter 13, Humanistic Psychotherapy. So, moving forward, we are going to really start to look at the different psychotherapeutic approaches and intervention models. So, this is for Psych 4380, clinical and counseling psychology. So let's talk about humanistic concepts. There are clinical implications that are very significant and really are part of humanistic psychology or humanistic psychotherapy. Number one is self-actualization. Self-actualization occurs because there's this knowledge within humanistic psychotherapists that people, just like plants and any other creatures in this world, have an inborn tendency to want to grow, to want to develop, that we want to go through phases of maturation and change. And humanists call this tendency self-actualization, right? And it presumes that if the person's environment fosters this type of growth and development, then self-actualization can actually proceed without interference. Now, the concern is, though, obviously from this perspective, you can start to hear it come along, that there are environmental factors, or maybe the individual themselves can interfere with this natural, innate, instinctive desire to drive and propel yourself forward, to develop and have growth and maturation. Now, positive regard is another basic conceptual component of humanistic psychotherapy. And again, this is really when this unconditional positive regard, or positive regard, is when people need to have certain things to live. Just like plants need sunlight, people need positive regard. They need warmth, they need love, they need acceptance. They need to have a social network of folks who are going to provide them with this. Now, the other thing that's important is something called prizing. Now, the founder of humanistic psychotherapy and psychology was Carl Rogers. Now, he frequently used the term prizing because he felt it best captured the experience of receiving positive regard from others. It's this notion of kind of getting these daily prizes that just fill you up and give you the full fuel that you need to progress in life, to self-actualize this tendency to improve and move up in life. So the goals of humanistic psychotherapy, there's 4 primary goals. So let's take a look at each one. The first one is, again, to foster that self-actualization, right? That's important. We talked about that as a basic concept, really having people find the innate desire to be motivated, to achieve goals, to develop, to mature. Number 2 is that the recognition that psychological problems are byproducts of the stifled growth process. Remember, humanistic psychotherapy says every person has this innate desire to want to achieve to their fullest potential. However, there could be some problems that interfere and stifle the growth process. So this is why this is one of the primary goals of humanistic psychotherapy, is to really understand what those psychological problems might be: depression, anxiety, eating disorders, personality disorders, right? Any other forms of psychopathology that can interfere with the stifled growth process. The third area and element of humanistic psychotherapy is understanding that, to achieve self-actualization, you have to have a strong foundation of self-worth. And a lot of times what happens in humanistic psychotherapy is to pay attention that the worth that parents places on kids. What was the worth and the value that was placed upon you when you were a child? And how does that now affect you in attempting to actually grow and mature and develop into a healthy adult with a strong well-being and achieving, again, self-actualization? Finally, incongruence and congruence of self, right? So congruence is a match between the real self and the ideal self. And as you can see, incongruence is when you don't have compatibility between the real self and the ideal self. So this is where humanistic psychotherapy attempts to focus on bridging that gap, or really bringing in congruence of the self, right? When you have congruence of the self, you're really connecting a match between the real self and the ideal self, and self-actualization can be achieved. The process of self-actualization is now going to be allowed to guide through the person to the next phase of achieving their own potential. Now, elements of humanistic psychotherapy. So what do you do in psychotherapy? Well, there's really these 3 different areas. Number 1, empathy. So Carl Rogers and other early humanistic psychotherapists really said you have to have empathy. Empathy is this deep, non-judgmental understanding of the mental health consumer's experiences. Again, it really does focus on the therapist sort of removing their own values, their own point of view, their own potential biases, and just having a genuine empathy for that individual. It's also known as client-centered therapy. Client-centered therapy emphasizes an empathic understanding, and this really provides a very positive impact for mental health consumers within humanistic psychotherapy. Unconditional positive regard. This is the second most important element of humanistic psychotherapy. So therapists must have full acceptance of their clients or their consumers, no matter what. Again, no judgment, full acceptance of who the person is and who they are. This helps to facilitate that idea of congruence, self-congruence, of making compatible that ideal self and the real self, the ideal self and the true self. And really that helps to not to compartmentalize these, but to connect these together where self-actualization can be achieved. So accepting the clients entirely and unconditionally will help them to explore themselves deeply and look at the incongruence that may exist between their true self and their true self and their ideal self, and really bridge that gap between those two, parse those two together, really map them to each other, and help to facilitate self-actualization. Now, of course, genuineness. This is also a very important element, right, of humanistic psychotherapy. Genuineness, the therapists themselves have to have their own congruence between true self and their ideal self. We also know they have to establish a relationships that feels really real. Now, of course, there's a therapeutic alliance that needs to be built, and also boundaries need to be built in within the therapeutic alliance as well, right? But a therapist has to be actually genuine so that that alliance feels real for both parties. And then a high degree of transparency. When you're very genuine, not only do you have positive regard and you have empathy, but you genuinely care. You are genuinely open and you're transparent as a therapist. Now, this is interesting, right? There's been a lot of research on these areas. And really this idea is that, these three are necessary, but not always sufficient, not sufficient enough to help a person become self-actualized. So really the goal of the therapist, or the elements of a therapist using this approach, must provide empathy, unconditional positive regard, and genuineness. They have to be part of it. Research suggests that yes, this is necessary, but it's not always sufficient to help a person achieve self-actualization. Although these three factors do contribute to the success of all psychotherapeutic approaches. So this is a common factor that you can see across many, many, many different approaches, although it really is a part of the elements of humanistic psychotherapy. All right, reflection is a very important therapist response. We looked at clinical responses in some of our earlier chapters, and here it is again. We know that reflecting someone else's feelings, or reflection, this is really an attitude more than it is a technical skill. When we practice these, sometimes they're going to feel like it's a clinical response, and so it's a technical skill. But really, humanistic psychotherapists understand that this is a true attitude. So according to Rogers, again, this is going back to Carl Rogers, he said this particular attitude should include humility. You need to be humble, which therapists can sort of lose if they're just reflecting someone else's feelings in a very mechanical, contrived way, because it's a technical response that you should be doing. So this is where that genuineness comes back into play again, right? And so we know that when a psychotherapist is actually reflecting the feelings of another person, rephrasing and restating their statements that highlight their feelings of emotions, again, this is what contributes significantly to the success of psychotherapy. And that's what's important here. You can hear a lot of, reflection of feelings, like you're reflecting back how the person feels. But really, ultimately, it's up to, according to Carl Rogers and this approach, it really is up to the client to understand, to know how to read their own feelings. They're the expert on their own feelings. You can guide them towards capturing that and understanding their own feelings. But the therapists themselves shouldn't become so overconfident that they think they know what the client's emotions are. They can rephrase, they can, restate sort of their statements that might highlight those feelings or emotions and allude to them, but it really is up to the client's own expertise to really dig into that and start talking about those emotions and feelings themselves. There are alternatives to humanism: existential psychotherapy, gestalt therapy. So, very much part of the humanistic camp of psychotherapy. Existentialism is really this idea that each person kind of comes to the realization that we're alone in this world and we're going to probably die. And when we die, we're going to be alone again, right? Because we rely on these social networks as social creatures. We rely on these connections with other people. And that realization that at some point in times in our lives, we're really kind of living alone on these isolated islands, that kind of idea can become overwhelming. And so there's a sense of like, I don't feel like I have any meaning. And so existential psychotherapy is helping a person to overcome that sense of meaningless that comes when they feel overwhelmed by the notion that they are really alone in the world. It tends to have a little bit more of a pessimistic view, but also a deeper analytic view of the self and sort of life and the meaning of life. So the goal is to really build a meaning of life and encourage clients to make choices that are really true to themselves. They're not doing things because society says so, or family says so, or the expectations within culture, but you're making your own true identifiable choices to move yourself to find meaning in life. Now, Gestalt therapy is a little bit different. Gestalt was founded by Fritz Perls, and emphasizes a holistic approach to enhancing your experiences. So holistic meaning including both mental and physical perceptions. Gestalt therapists attend to both what the client is saying verbally, but also what they might be saying physically, what's happening in their body, where they might have pains, right? Looking at this holistic approach. There's a tendency to de-emphasize the client's past experiences and really focus exclusively on what's happening in the ever-present now. And that's the focus of the therapeutic intervention. Other alternatives to humanism, another one is motivational interviewing. Now, motivational interviewing, also known as MI, is a therapy that has actually garnered a lot of empirical evidence. It has widespread influence on the field. Motivational interviewing is a revised application of the humanistic principles. It was originally used and developed to treat addictive behaviors like substance abuse and other substance use addictions. And really the focus here is the practitioner themselves doesn't pressure the clients to change, tell them what to change, how to change, and where to change. But it really is about the individual sort of identifying sort of where, what they can do in life to improve themselves as well. Motivational interviewing can augment any other type of therapy that we'll continue to explore. The central principles of MI is expressing empathy, right? So taking the client's point of view and really honoring and valuing their feelings and their experiences. This is vital, absolutely critical to the motivational interviewing. Developing that discrepancy. The discrepancy, again, is highlighting how, what a client might say and what they might do be inconsistent. We've talked about this a little bit before. In other areas, it can be called confrontation, but it's not creating conflict or really creating a confrontation, but it is pushing a person to sort of recognize these discrepancies, that perhaps there's some behaviors that are maladaptive and are inconsistent with that particular client or mental health consumer to achieving their own goals or maybe even what they value. Avoid argumentation. So again, MI therapists do not directly confront clients, as I mentioned before, especially if clients are engaging in self-destructive behavior, those that are substance use and abuse. That can kind of pull therapists in and then not have appropriate boundaries. So you have to be very avoidant and recognizing, understanding sort of what might be your own triggers as a therapist. Rolling with resistance. Look, clients can be hesitant about the process, right? So the therapist has to accept and reflect on any resistance that may be taking shape. Again, often used with people with substance use addictions. And reflect on why the person is being resistant rather than trying to challenge it or battle against it. Sustained talk is very important. Sustained talk and change talk. Resistance to change is really often communicated by clients as sustained talk. And so it's just a manner by which clients can communicate. And so then, therefore, it's up to the motivational interviewing process in this approach to humanism. It's up to the psychotherapist to really kind of figure out how to flip or to change that talk, to really change a point of view with the person. And what has been noted by many researchers, that if you're really successful at, at moving that person's sort of script and self-talk that they have in their mind that is sustained, and you move them towards changing that self-talk to something more adaptive, then this can predict positive behavioral changes. And then supporting self-efficacy. Motivational interviewers using this humanistic approach really kind of impose upon the clients that they have the power to improve their lives. And it's the role of the therapist is to really just be a facilitator, but it's the client that holds all the power. It's the client that, can really be the one that move forwards and make the change, not the therapist. Other alternatives is positive intervention or strength-based counseling, which emphasizes human strengths, tends to denounce the psychopathology or any pathology, and just focuses on the individual's strengths rather than weaknesses. The idea of cultivating happiness and joy within a person ultimately helps to reduce the symptoms. So if you find the person's strengths, what they're very good at, and cultivating a sense of joy and happiness in every daily experiences that they have strengths in, then that in and of itself will reduce the symptoms. So the focus isn't on the weaknesses and the pathology, it is really on the strengths. And there's 4 areas of each client's lives that have to be paid attention to. It's called the forefront approach, developed by Beatrice Wright and others as well, and encourages the therapist to consider these 4 different areas. So even though you're doing a positive interventions and a strength-based approach, you do need to understand what those weaknesses are that could undermine the strength-based characteristics. So you need to look at the strengths and the assets and possibly what is interfering with some of those strengths. Identify those destructive factors and then identify maybe resources and opportunities in the person's environment that will help them to remove those destructive factors and refocus their energy on those strengths and assets within the individual. Another alternative within humanism is positive psychology. Within positive psychology, really there's specific techniques. As it is what you can see there, it's a very positive approach. These positive interventions and strength-based can be blended into any one of the other forms of therapy and humanistic types of, humanistic therapies. But really it starts with savoring, right? This is when you encourage a client to intentionally focusing on a moment of joy and happiness, like savoring the moment. Gratitude to help a client to really find a way to be thankful to themselves. It could be a self-reflection. It could be a mindfulness moment. It could be journaling something to themselves or writing a letter to someone else just to simply say, thanks, I'm very appreciative. Kindness is another form of positive psychology. We know within our research, if we do things for others, then we have secondary gains and it fills us up and have our own fulfillment needs being met. Empathy is important as well. Clients themselves, not within the therapist, but the clients, just as much as the therapist, must gain a sense of empathy. They need to build a sense of understanding and even forgiveness and have perspective taking with others in their lives. They need to try to understand someone else's perspective before they can even go through a process of forgiveness and understanding. So empathy is very important. Optimism as well. Having very optimistic, positive expectations about their future and good things that are happening in life. Strength-based activities, deliberately doing things to kind of garner those personal strengths. Maybe, again, something that the client, talks about deliberately they're going to do or change or maybe write about. And then again, meaning. The client in positive psychology is constantly reminded to sort of think about what their own values are and to set their goals in life that are meaningful to them. The interesting thing is that all of the different techniques within positive psychology, most clients find to be very, very acceptable and a lot easier to incorporate into their lives than some other approach techniques. Emotionally focused therapy is another alternative to humanism that falls with this umbrella as well. This is short-term humanistic therapy, and it actually has a lot of significant empirical evidence when we're looking at emotion-focused therapy. It's very popular within couples, and it's highly practiced within couples. So a lot of therapists who are using a humanistic approach use emotionally focused therapy, also known as EFT, and it's kind of raised a lot in popularity in more recent years. And really the focus here is to emphasize the expression and acknowledgement and healing power of emotions in present moment, not emotions in the past, not emotions that you're going to bottle up and stifle for a long period of time, but emotions that you're going to talk about and that you're going to acknowledge and that you're going to express here and now in the present. Now, there's other modern theorists, Bohart and Tallman are a couple of other modern theorists that are starting to go against that symptom focus, paying attention to the psychopathology and looking at these, empirically evidence manualized approaches, because they feel like, the therapist can't, mobilize the clients the way that they should be mobilized. They're not acting as facilitators anymore. The guided manuals, even though with empirical research evidence, are mobilizing the client to move forward rather than the therapist, and you'll lose something in that context. So modern theorists feel that therapy is the process of trying to create a better problem-solving climate rather than one of trying to fix the person. And a lot of times these manualized therapies are looking at problem, fix one, fix two, fix three, and so on and so forth. But when you move away from that and allow the therapist to facilitate the client to mobilize themselves, then this is really what helps a client to become better problem solvers in all of the issues that are kind of happening in their life. Finally, to wrap it all up, really the big question is, how well does humanistic psychotherapy work? Let's go back to Carl Rogers. We mentioned him at the beginning. He is absolutely the pioneer of psychotherapy outcome research. The approach, humanistic therapy itself, doesn't lend itself very well to empirical tests, but in spite of that, Carl Rogers spent a lot of time, developing his own theoretical writings and creating a framework by which humanistic psychotherapy could be used. It's very hypothesis driven as well. The three conditions of empathy, positive regard, and genuineness, this is an important role in the success of any kind of therapy. And in fact, these techniques should definitely be employed regardless if you're doing humanistic therapy or not. And then finally, motivational interviewing, which is a component of humanistic psychotherapy, is a bona fide evidence-based psychotherapy. The empirical evidence on this particular, again, this MI or motivational interviewing has been extremely successful, and mostly because it works for a wide range of psychological problems, even physical problems, or both together. And it really does help to improve the health and well-being of people regardless of the psychopathology type. Okay. And that ends our chapter on humanistic psychotherapy.